Good morning, all. I am Dr. Palak Singh, Department of Conservative Dentistry and Endodontics, BBDCODS, BBD University, Lucknow. So today I'm here to talk about the topic nomenclature system and terminologies of tooth preparation. So, starting from introduction, what is nomenclature? It refers to a set of terms used in communication by individuals in the same profession that enables them to understand one another better. Now, why do we need such kind of nomenclatures? These systems are basically used by the dentist to associate information to a specific tooth in clinical practice. Some shorthand system of tooth notation is necessary for recording data. Hence, to do so efficiently, it is necessary to adopt a type of code or numbering system for such kind of nomenclature. Now, the types of numbering system. Several systems are available all around the world, but the three most common systems which are adopted are Universal Notation System, Zsigmondy-Palmer Notation System, and Federation Dentaire International System. Now, you must be aware of the primary dentition and permanent dentition. So, let me just brief you about it. Primary dentition that contains at least 20 teeth, which includes the central incisor, lateral incisor, canine, first molar, and second molar. Similarly, we have it for mandibular dentition also. So in total, there are 20 teeth. In permanent dentition, it consists of 32 teeth, including central incisor, lateral incisor, canine, first premolar, second premolar, first molar, second molar, and third molar. So each arch consists of 16 teeth. So both the arches will include 32 teeth. So first system which is being used for numbering is the universal notation system. So if you have to denote the primary teeth, this system, it uses uppercase letters for each of the primary teeth. For maxillary teeth, beginning with right second molars, it starts with letter A through J. So the right second molar will be denoted by letter A and the left second molar will be denoted by letter J. So in the same way, for the mandibular teeth, it starts with K for the left lower mandibular second molar and extends till T. So for maxillary teeth, it begins with right second molar A to J, and for mandibular teeth, it begins with letter K through T. The EDA in 1968 officially recommended the universal numbering system. So this was for primary teeth. Now for permanent teeth, for the right upper second molar, it starts with number 1 and extends till number 16 for the left upper second molar. And similarly, for mandibular dentition, it starts with left lower second molar with number 17 extending till right lower second molar, that will be denoted by number 32. So 1 to 16 for the maxillary dentition and 17 to 32 for mandibular dentition. The universal system of notation for permanent dentition uses numbers for each of the permanent teeth. Yes, this is the difference. For primary teeth, they use alphabets, whereas for permanent teeth, they use numbers. So the maxillary teeth, they are numbered from 1 to 16, beginning with the third molar. And then for the mandibular left third molar, it starts with 17, extending till 32. So this was about universal notation system. So just a brief example of it. For permanent teeth, starting with right upper maxillary third molar, it starts with number 1, extending till left upper third molar denoted by number 16. Then left lower third molar is denoted by number 17, extending till 33 to, that is the right lower third molar. Now for primary teeth, starts with alphabet A. Second molar upper right is denoted by alphabet A, and then left upper second molar is denoted by letter J. Then left lower second molar is denoted by K, extending till right lower second molar denoted by T. So this was universal notation system. Now coming to Zsigmondy-Palmer notation system. This is a symbolic system. In this system, the arches are basically divided into quadrants. That is, first we have two arches, maxillary arch and mandibular arch. Now these arches are divided into quadrants. So each arch will contain two quadrants. That is, maxillary you will have the right quadrant and left quadrant, and mandibular also you will have the right quadrant and left quadrant. So upper right is denoted by this symbol, upper left by this, lower right and lower left. Now the Palmer notation system for entire deciduous dentition is as follows. So here, this is also denotes the primary dentition by through the alphabets. Now the denotation is used by using alphabets like A to E. So the first quadrant denotes the right upper quadrant, and the second quadrant denotes the left upper quadrant. Then third quadrant denotes the left lower quadrant, and fourth quadrant denotes the right lower quadrant. Now, for permanent dentition, it's a four-quadrant symbolic system, beginning with central incisor. The central incisor, they are numbered as 1, extending till number 8, which is the third molar. So, if we show it diagrammatically, this is number 1, which is denoting central incisor, number 2, lateral, number 3, canine, number 4, first premolar, number 5, second premolar, number 6, first upper molar, number 7, second molar, and number 8 would be the third molar. So in the same way, you will represent each quadrant. So the first quadrant is this one, second, third, fourth. You go in a clockwise motion. This is Zsigmondy-Palmer notation system. So just an example, primary teeth, A, B, C, D, E. This is for the first quadrant, that is central, lateral, canine, first molar and second molar. First quadrant, second quadrant, third quadrant and fourth quadrant. Similarly for permanent teeth, first quadrant, second quadrant, third quadrant and fourth quadrant. So each tooth has got specific number. So for example, if you have to tell me about the right canine, first we'll make the quadrant symbol and then we'll denote the number of the teeth. Like this is the number for canine, and right maxillary canine, that means first quadrant. If it would have been left maxillary canine, then we could have shown it in the other way, this way. Here 3 would be on this quadrant. Then similarly for the left lower, it will be on the third quadrant. Then right lower will be in the fourth quadrant. Now, the Federation Dentaire International, it's a 2-digit system. This was proposed by FDI, then it has been adopted by WHO and by other organizations such as International Association for Dental Research. The first the first digit indicates the quadrant number, that is 5 to 8 for primary dentition, and second digit indicates the tooth within the quadrant, that is the number for the tooth which has been used earlier. So as an example, if you have to show it for the primary teeth, 5 is the first quadrant, 6 second quadrant, 7 third quadrant and 8 is fourth quadrant. So first digit would be the quadrant number and then next digit would be the tooth number. So if you have to denote our right upper central incisor, that would be 5-1. Now, for the permanent dentition, the first digit indicates the quadrant. So in primary, we use 5 to 8 and in permanent, we use 1 to 4. And the second digit indicates the tooth number within the quadrant for the permanent teeth. For example, the permanent upper right central incisor is 1-1 and permanent left central incisor is 2-1. Similarly, if you have to tell me about the permanent left canine, that would be 2-3. Now, if you have to tell me about permanent left molar, first molar, that would be 3-6. Now, terminologies related to various tooth surfaces. The coronal portion of tooth is divided into surfaces. The mesial surface is a surface which is closest to the anterior midline. Distal surface is a surface which is away from the midline. Then the labial surface, which is towards the lip. Buccal surface, which is towards the cheek. Facial surface, which is towards the patient's face. Here in the diagram, as you can see, the mesial line is a line which is present towards the midline. and the distal line is the one which is present away from the midline. Labial towards the lip, lingual towards the tongue, buccal towards the cheek. So the lingual is the tooth surface that is towards the tongue. Incisal is the functional edge of anterior tooth. Occlusal is the masticating surface of posterior tooth. Cervical, the cervical part is the surface of the tooth which is present close to the neck or cervix of tooth, and gingival is the surface which is present close to the gingiva. This was about the terminologies related to various tooth surface, that is mesial, distal, facial, buccal, labial, lingual, incisal, occlusal. Now, coming to the tooth preparation terminologies, what is cavity? This refers to a defect in the tooth enamel or both in enamel and dentin due to caries progress. Tooth preparation is the mechanical alteration of a defective, injured or diseased tooth to receive a restorative material that reestablishes a healthy state for the tooth, including aesthetic correction where indicated and normal form and function. This definition is very important for whatever purpose. Do be thorough with it. Now, there are different types of tooth preparation. Simple tooth preparation, compound, and complex depending upon the number of surfaces involved. Simple tooth preparation is the cavity preparation involving only one tooth surface. Compound is the cavity preparation involving two surfaces, and complex involving three or more surfaces. So this is your complex as it is involving three surfaces. This is a simple tooth preparation as it is involving only occlusal surface. The tooth description, the abbreviations used in this chapter is the tooth description of tooth preparation is abbreviated by using first letter capitalized of each tooth surface involved. For example, if you have to denote occlusal surface, you will mention O. If you have to denote mesial and occlusal surface, that is any cavity involving both the surface, you will denote it as MO. And if it is involving mesial, occlusal and distal, you will denote it as MOD. Tooth preparation walls. Internal wall, it is a prepared surface that does not extend to the external tooth surface. An external wall is the prepared surface that extends to the external tooth surface. So the wall which is present extending to the internal, the wall that is not extending to the external surface is the internal wall, whereas the one which is extending to the external surface is the external wall. Axial wall is an internal wall parallel to the tooth surface, and the pulpal wall is a wall perpendicular to the long axis of the tooth and occlusal of the pulp. Floor or seat. A seat or floor is prepared wall that is reasonably flat and perpendicular to the occlusal surface, which is directed occlusal gingivally. Enamel wall is that portion of the prepared external wall consisting of only enamel, whereas the dentinal wall is that portion of prepared wall consisting of dentin in which mechanical retentive features are located. So here you can see this is your distal wall, this is your facial wall, then this is your gingival wall, the lingual wall, axial wall and pulpal wall. Now, tooth preparation angles. Here, angle refers to a junction of two or more surfaces of cavity preparation. Now, there are different types of angles, line angles and point angles. And line angles also subdivided into internal line angles and external line angles. Line angle, what is line angle? It is a junction of two planar surfaces of different orientation along a definite line. Internal line angle whose apex points into the tooth, and the external line angle is a line angle whose apex points away from the tooth. Point angle, it's the junction of three planar surfaces of different orientation. So line angle was junction of two planar surfaces of different orientation, and point angle, it's the junction of three planar surfaces of different orientation. So these are your different line angles and point angles. This will be explained to you through a demo in a practical lecture. Now the cavo surface angle and cavo surface margin, this is also very important. It is the angle of the tooth structure that is formed by junction of prepared wall and external surface of the tooth. The actual junction is referred to as cavo surface margin. So this This is the prepared wall and this is the external tooth surface. So the angle formed between the two is the cavo-surface angle. Now, so I hope everybody is thorough with this time. Okay, so coming to classification of tooth preparation. Classification of tooth preparation according to an anatomic area and by associated type of treatment was presented by G.B. Black, that is Green Wardaman Black, and designated as Class 1, Class 2, Class 3, Class 4, Class 5, and Class 6. Class 1 cavity, this includes cavity preparation involving pit and fissure areas of the teeth. It involves the following areas, that is occlusal pit and fissures in posterior teeth, occlusal 2/3 of the facial and lingual surfaces of molar, and lingual pits of maxillary incisor. So these 3 points are important for class 1 cavity. Class 2 cavity, this involves one or more proximal surfaces of posterior teeth. Class 3 cavity, the cavity which includes preparation on the proximal surface of anterior teeth but without involving the incisal edge, whereas class 4 is the one involving proximal surfaces of anterior teeth with involvement of incisal edge. So that is the difference. Class 5 cavity, this involves cavity preparation on gingival 1/3 of facial and lingual surfaces of all the teeth. So the cavity which is present on the gingival surface, we call it as class 5 cavity. Class 6, this involves cavity preparation on the incisal edges of anterior teeth or occlusal cusp heights of posterior teeth. So as you can see, the cavity which is present on the occlusal cusp heights or at the incisal edge, this is class 6. So once again, if we go through it, very important. Class 1, which involves pit and fissure areas of the teeth, that is including occlusal pit and fissures in posterior teeth, occlusal 2/3 of the facial and lingual surfaces of molar, and lingual pits of maxillary incisors. Class 1. Class 2, this involves one or both proximal surfaces of posterior teeth. Class 3, proximal surfaces of anterior teeth without involving the incisal edge. Class 4, cavity preparation on the proximal surfaces of anterior teeth with involvement of incisal edge. Class 5, this involves gingival 1/3 of the facial and lingual surfaces of all the teeth. Then class 6, involving the incisal edges of anterior teeth or occlusal cuspal heights of posterior teeth. So this was all about the nomenclature and terminologies of tooth preparation. So the classification is very important. Then the line angles and point angles, this is very important for exam purpose. And the definition of tooth preparation. Plus this Zygmundi Palmer system, Federation Dentaire International system, every dentist, they should be thorough with it. So that was all about the nomenclature. We'll continue in the next lecture. Thank you.